Hello friends, in this video I intend to talk to my nursing colleagues who work not only in India but across the globe. Recently, in our personal communication with some of them, they posed this question to me. I want to be the best. Tell me how. And I'm here through this video to speak to you about this how. And in this first video, I'll touch upon those traits which I consider of immense value and those which you should continuously evolve within yourself. If you look at this graph of the amount of trust each profession has amongst the people, you will notice here that medical doctors have very high degree of trust, and this is the data from the US. But who comes on the top? The nurses come on the top. If you see a similar data from United Kingdom, here also you will see that doctors do have very high regard in the eyes and mind of people, but again here the nurses score higher. But if you look at the Indian data, and as per this survey which was done after the COVID, the armed forces in India and then scientists working in India, the teachers teaching in schools of all levels, the doctors and judges have very high degree of regard amongst people in this order. But somehow nurses are missing here. And this is an area of concern. If you are a nurse, male or a female, and if you have to offer some services to the patient, then what? What is in the patient's mind and what is in your mind? If you have to follow one golden rule of enriching the relationship between nurse and a patient, and you are a nurse, from your point of view, you should always try to do more than his or her expectations. Just a general simple formula. Whatever you do to him or her as a nurse, do more than his or her expectations. What are the patient's expectations? Let us look at some of the common things. Many patients have in their mind a personal appearance view of a nurse. The patients want their nurse, typically in India, would be a female, because a female is more caregiving, more concerning. Obviously, they want them to be attractive, well dressed, good hairstyle, good shoes. These points are important for an initial interaction and initial impression. But when it comes to the matter of service, the patients will look at your professional traits. And these professional traits are your communication skills, the confidence in you, your professional competence, your ability to give comfort, and the amount of concern and care you have for your patient. We'll talk about these traits one by one and how can you continuously evolve these traits within you. But as I said, in the first appearance, your physical appearance counts a lot to the patient. Here, I want you to add one more thing, and that is whenever a patient is admitted in your ward under your care, you as a nurse and all your team members of nursing community who are going to attend to that patient should go to the patient bed and introduce yourself one by one. I am so and so, my name is this, I am here to serve you. And then before you go and speak to the patient, I am so and so, you gather some preliminary information about the patient from some other sources. Doctor who has admitted the patient, or reception who has admitted the patient, or through some source, if you know in your internal mechanism something about the patient, the name, the family members, the kind of disease the patient is having, how sick is he. If you know something about the patient already, and you go to the patient and talk to the patient by name and tell him that I know about your disease and I know how serious are you, we'll look after you. We are here to help you sail through the crisis. And you have to not only reassure the patient, but also take time to talk to the relatives individually and reassure them. So your first meeting with the patient should be such that it sets your impression right. And then comes the question of subsequent traits which should be there in you. And as I mentioned to you, communication, your confidence, competence, comfort, and concern and care. These 5 C's are the most important professional traits that I consider each one of you should have, and each one of you should have a very high level of these traits. What is the communication in reference to the nursing community? The communication wise, first of all, you should have an immense ability to listen. And when I say listen, people listen through ears, but nurses should listen through their eyes. And they should have highest degree of attentive listening. Have eye-to-eye contact with the patient when you're listening to the patient's problem. Then you must appear understanding in temperament, that you are able to understand about the patient's problems, his disease, and not only disease, but you are able to understand his psychosocial problems. And everything, when you're trying to be understanding, should be in an empathetic manner. And then the expression that you have should be polite. The words that you utter to the patient should always be polite. And then your body language also should be reaffirming. You may have treated 10 patients before you came to meet this particular patient. It does not matter. But in the individual interaction, don't reflect your tiredness. Don't reflect your irritation. Your body language should be very comfort giving. So your expression should be a very confident expression. So if you want a summary of communication, what are 3 essential features of communication? Attentive listening, confident communication, and empathetic temperament. Then is the second trait, which is the competence. When I say about competence and confidence, you will immediately start thinking of your professional capabilities, professional competence. It's important that you should have good factual knowledge of your profession, and you should be very sound in the technical delivery of your skills. How to give injection, how to set an IV line, how to pass a Riles tube, how to pass a Foley catheter. All those technical skills with you should be par excellent. So that is professional competence, and you should have that. But it is also important for the patient that you know every single detail about your hospital where you are treating the patient. Because you'll be interacting with the patient most of the time, and he or she will ask you some questions. And then you should sound knowledgeable. You cannot say, oh, I don't know about this. This looks very sort of insulting to the patient. For example, you should be knowing everything about administration, who is the CEO, who is the manager for nurses, who is accounts person, reception person. You should know about the doctors very well, their qualifications and capabilities, all other nurses working along with you, the paramedical staff, the technicians, whosoever is going to be in contact with the patient while the patient in hospital, you should know every single detail. And when it comes to a matter of your confidence and your competence, as I see, much of it comes to you from your parenting when you are brought up in your family. And then much of it comes from your schooling, the kind of school you have been educated in. But then, whatever it is extremely important for you to have a confident expression. There are some people who are very good at it, some people are not very good at it. But if you are not good at it, you can work at it and continuously evolve in this area by practice, by watching others. Then comes the care and comfort. The care and comfort, if you have to look after the body maintenance of your patient, the way you handle the patient, his or her body, the way you do that job speaks very high of your capabilities. Every single thing that you do to the patient should be in a manner that will give comfort. And while you are doing this, at that time, you must understand patient's disease. You must know the family background. You must know the social background. You must know the economic background, because it is on that basis, on family, social, and economic background, the patients have the expectations from you when it comes to the personal look after. And finally, whatever you're going to do to the patient, please ask about her previous impressions. If somebody has been there in some other hospital, some other ward, some other bed, under the care of some other nurse, you can ask what has been her impressions about this kind of service and what are her expectations. The comfort and caregiving, when you're doing this, please talk to the patient. And when you talk to the patient, you can find out all that thing which I just mentioned. The disease, the family background, the social background, the economic background, personal impressions. You can talk, converse with the patient, and you can learn about it. But then you have to be smart here also. And it is not only that by conversation you will know it, you can know a whole lot by just observing the patient. And you can know whole lot sometimes by overhearing what patient is talking to her attendant. So the comfort and care, where are these issues most important? These issues are most important. First of all, say for example, some patient is admitted under you for a surgery, a daycare surgery, a daycare procedure. So you have to inform to the patient before the surgery actually takes place. And patient will have lots of questions in the mind. There you have to talk to the patient, inform the patient before the surgery actually takes place. And it is your responsibility to build confidence in the patient's mind about the capabilities of your doctor, your technical team, OT services, anesthesia services, and so on. So, if you are able to inform the patient properly in a manner which is soothing the patient, then the patient goes through surgery without any stress and a whole lot of complications can be prevented. Then, sometimes you as a nurse are there when the procedure is being done. Say, for example, some endoscopy procedure is being done or some minor procedure is being done, and you are by the side of the patient. At that time, you have to be interacting with the patient in a way that you offer comfort to the patient. And finally, when the procedure has finished, you have to cross check what has been her experience, his experience, and how has she felt. So, friends, please take time to inform before a surgical procedure is done to the patient. While a procedure is being done, be interactive, be comfort giving, and when the procedure is finished in the post operative period or in a post procedural care, be with the patient and offer again your comforting words. So, at all these three levels, you have a place where you can show your warmth of personality and help the patient recover faster and quicker. Then the concern. The concern means that you are actually interested in the patient's quick recovery. You are actually interested in the patient welfare. How do you show that? My way is that whatever is the need of the patient during the treatment, if you as a nurse can look after that need before the patient is speaking about it. Just like you're in a family and you have your parents, father and mother, and if you can look into the needs of your parents before they speak it out, it shows that you have high degree of concern for them. Same thing happens for your patients. For example, if you have a patient admitted under you, let patient not come and tell you, check my blood pressure. What is my temperature, sister? Is my pulse rate all right? Why? Why should patient say this to you? It is your responsibility to look into this much before the patient demands for this. So you have to carefully watch all disease parameters which might show you progression or deterioration or improvement or vice versa. So all these parameters you should yourself look into timely, frequently, and as many times as possible. More you involve yourself into this, more will be the concern shown from you to the patient. Then you must ensure and track that the patient's blood sample was sent in the morning. Is the report ready? When is the report coming? If you're asking somebody in the ward, bed number 6 says, I've sent blood sample for investigation, I want to know what is the report. And you're doing this without the patient asking for it, right? About the medications. A doctor comes on round, writes some prescription for the patient, and then you're cross-checking with the doctor. You have prescribed so much of medicine for the patient. He was taking this before. He has allergy to this. So many things. If you do this without the patient asking for it and patient is listening, lying in the bed, you can imagine what degree of comfort the patient will have. Then you have to monitor that whosoever is giving service to the patient under your care, may it be a kind of some ward boy who's going to shift the patient from bed to the couch, or may it be somebody who's changing the dress of the patient, may it be somebody who's changing the bed linen, may it be somebody offering hygiene care. Whatever, whosoever is coming to attend to your patient, you be there as a watchdog and tell that person, look, my patient is not well, don't do this. Or if you have to do this, do it this way, the way I'm telling. And if you tell this to the person offering service and your patient is watching it, listening to it, you can imagine how comfortable will he be. So finally, I said that there are 5 traits which I consider of paramount importance: communication, your confidence, your concern and care, comfort giving temperament, and your competence. How do you evolve these traits? You have to keep seeking knowledge in all these areas continuously. You have to keep evolving your skills and you have to keep improving your attitude. If you remember these 3 things, your level of knowledge, your level of skills, and your attitude, and you are in a mode to improve all these things consistently and continuously in all those 5 areas, whatever you are today on the basis of your previous work experience. And because of that, you are a respectable nurse today. But then, when you're working with somebody and you're working with your full energy and intensity, you have the ongoing experience. And this ongoing experience, your software should be continuously updated And then that you do by seeking inputs from your senior colleagues, junior colleagues, doctors, technician, whatever question comes to your mind, please ask everybody so that your software is updated. And these days, when you're free, you can scroll down in your computer, laptop, mobile phones and take inputs from social media within a fraction of a second. So you can improve all these areas, be a person who wants to genuinely improve your own self. So remember what I said, you have to deliver services to the patient more than his or her expectation, and then you have to continuously work to evolve your own self. Set your bar higher every day. I hope you understood my points, and I thank you very much for your patient listening.